After covering the extraoral exam with your patient, it's now time to move into the oral cavity. However, before we go through and start to venture into the oral cavity, it's extremely important for us to first look at the lips as well as the vermilion border. Remember, herpetic lesions may also present themselves in this location, so it's extremely important before just jumping in to taking a look and seeing if we notice any abnormalities, lesions, or irregularities to see if we may have to, unfortunately, postpone treatment. So as we go through and check out our patient that is here today, you also want to look at the corners of the mouth to make sure that there's no cracking or bleeding in any chapped regions. Now, as you can tell, this patient here had a little bit of chapped lips. However, the vermilion border seems to be intact. And as we venture down to the lower lip, you can notice a little bit of these bite marks that the patient may be causing trauma to herself. Same things with the inside. So before we go fully inside the oral cavity, always important to take a look at the lips. Now, if your patient does present with extremely chapped lips or cracking, why not provide them with some type of chapstick or maybe some Vaseline? Because remember, we are going to be moving and manipulating this region. So we really want to make sure that we're caring for the patient in all aspects. Now, after we go through and we've done our inspection of the vermilion border and lips, we're going to go into the oral cavity. Now, we're going to have the patient open. And what we want to do first is we actually want to inspect. Just like we did with the lips on the outer regions, we want to inspect to see if we see anything that may cause us to postpone treatment. Herpetic lesions that may present themselves extraorally may also present themselves intraorally. So it's good to just slightly move down the lower and the upper lip, pull back the buccal mucosa, and take a look with your index finger to see if you notice anything suspicious. After going through and palpating slightly, you want to go inside the oral cavity and take a look. You want to briefly inspect the palate as well as the hard and the soft tissue, the rugae, taking a look on the inside of the buccal mucosa. As you can see here, this patient actually has an extreme prominent linea alba that presents itself on the left and does also present itself on the right-hand side. So these are regions in here where you can see this definition or this defined line where this patient may be biting her lip constantly. Now, after going through and taking a look, you also want to drop down to the floor of the mouth to take a look to see if there's anything that we suspect may be present that may cause us to postpone treatment. So far, everything seems to be well and that we can proceed. Now, the next thing that we need to do is we do need to inspect the inside of the lips and the cheek. So this is actually going to cause us to want to do a palpate motion. Remember, when we're palpating, you want to make sure that because with my index finger, I've already touched the patient's saliva, you don't want to touch it on the outsides of their face. So during this palpation technique, it's important to make sure that you know what fingers have touched saliva and which fingers have not. So first I'm going to palpate the left side of the cheek. I'm going to use my left hand, take my index finger, start posterior, buccal mucosa, and I'm actually going to palpate all the way down to the midline. Now I'm going to do the same thing with the left side, right index finger, middle finger and ring finger, palpating. Remember, you want to compress the structure between two hard objects. So it would be my fingers with the tissue right in between, all the way to the midline. Now that we've done the posterior region, we want to double check to make sure that we're doing the lower lip as well. So my index going inside where saliva has touched, with my middle finger palpating the lip, especially since the patient presented herself with bite marks, we want to make sure we don't have any lumps, bumps, or any irregularities. Now, once complete with the lower lip, we need to move to the upper lip. Same thing, we're going to use our index fingers, pull back. Using your middle fingers, you want to palpate the patient's upper lip, retracting this tissue all the way back. Wonderful. Now, once we're done with doing the lips and the cheek, now we need to venture to the floor of the mouth. So just like we did in the very beginning, we need to inspect first. So it's usually important to have your patient kindly put their tongue to the roof of their mouth, and then you just want to take your mouth mirror and look at the floor of the mouth to see if you notice anything of suspicion or concern that would cause you to postpone treatment or, of course, cause you to bring your doctor in or possibly alter treatment on behalf of the patient. Everything looks good. Now we need to also apply a little bit of palpation. We're going to do that same technique with the index finger. So remember, we have the submandibular and the submental glands down here. So it's going to be important you use your index finger, your middle, and your ring finger. Ask your patient to kindly open. And you want to compress between these structures all the way up to the midline. Now for the right side, index, middle, and ring. Palpating these glands all the way up. Now we have to check this, the salivary gland function. So remember, it's going to be important here to make sure that you dry the area lightly with gauze. So why don't we go through and start with our sublingual caruncles. Now again, when the patient has their tongue to the roof of their mouth, you want to gently dry it with some gauze. And then you want to apply a little bit of pressure below this gland and apply pressure up with your Q-tip. Remember, this is going to let us know if we notice any hypo or hyper salivation, because as we know, a lack of salivary flow can be detrimental to the overall oral cavity. Now, next, we want to check our parotid glands. Now, remember, with the parotid gland, the Stenson's duct also comes out of. So it's going to be important to make sure that you ask your patient to close a little. You want to retract this buccal mucosa. Now, remember, the parotid gland, as you can see beautifully right here for our patient, is going to be a small little raised area. So again, you want to make sure that you're drying the area slightly. And then you want to apply pressure below the gland and slightly roll the cotton tip up. Wonderful, because you want to make sure that you're able to see the salivary flow come out with ease. Now, you're going to be performing the same function on the left side as well. So you want to make sure you retract and that you dry the area. And same thing, you want to make sure that you locate it. Beautiful, right here. And then you want to press underneath this gland, rolling all the way up, getting that saliva to come out with ease. Wonderful. Now, once we're done, you also want to make sure that you're checking the tongue. Remember, the tongue is the most common place for oral cancer. This region, whether it's on the ventral, the dorsal, or the lateral borders, are all the number one places where oral cancer presents itself. So make sure that you educate your patients and let them know what you're going to do before you perform it. Sometimes patients may find it uncomfortable for you to palpate their tongue or manipulate their tongue while inside their mouth. So let's make sure that you educate them on the importance of it, because you are, as a hygienist, are going to be the one that's probably most often inspecting their mouth. Now, let's first start out with having our patient open, relaxed, gently sticking their tongue out. Now, we want to notice if we see any scalloping on the tongue, right? Sometimes patients present themselves with a fissured tongue, with a geographic tongue, with light coating, black, hairy tongue, things like this. So it's nice to have the patient just gently open so we can just overall take a look at the overall appraisal of what the tongue is presenting at this point in time. You can see that this patient has got extreme scalloping on the lateral borders of the tongue, okay? Looks well. Now, first we want to look at the ventral surface of the tongue. So gently have the patient put the tongue to the roof of their mouth, and then you want to make sure that you're looking at this posterior angle as well. So take your mouth mirror, open big, thank you, and you want to make sure you're dragging just a little bit of pressure, making sure that if you notice anything from reflecting that illumination of the light onto the ventral surface of the tongue. Another thing to look for while you're down here is going to be the frenum. Remember, the sublingual frenum sometimes may be short for certain patients. In that case, sometimes we call that tongue-tied. This can have some implications for a patient, so it's important to identify that ahead of time. Or in some cases nowadays we see, some patients present with intraoral piercings. This is another issue that you want to make sure that you address and take a look at both the teeth as well as how it's affecting the tongue. Now let's move to the dorsal surface of the tongue. So you gently want to have your patient open, stick their tongue out, and notice the piece of gauze. I just want to grasp the tip of the tongue. Remember, if you are covering the tongue, you may miss something that may present itself. So by just simply grabbing the tip, extending it out to the left, be careful of the incisal edge of the teeth, and observing, same thing, move it to the right, observing from posterior to the anterior portion. Beautiful. And then you want to make sure next you tell your patient, I'm going to go through and palpate the tongue just to make sure I don't feel any lumps, bumps, or anything irregular. Now, Once you're done palpating the tongue, you want to make sure that you are also checking the lateral borders with your mouth mirror. It's always good to pull back some of the soft tissue because you may miss something beautiful while palpating or inspecting. So it's always good since this area is so susceptible to oral cancer. Wonderful. Now that we've gone through and inspected the tongue, the next step is going to be the palate. Now remember, the hard and soft palate for patients may be extremely sensitive or ticklish. So patients that may have a high gag reflex, you want to make sure that you're not swiping with your index finger, rather you're palpating and applying small pressure. One, we want to be able to identify anything such as tori, or two, open, we want to see if there's any herpetic lesions, denture stomatitis, anything that may be a variance from normal. So remember, index finger, slight palpation, do not drag. You do not want to cause your patient any discomfort or to gag. Now, next, we're going to venture to the tonsil and the oral pharynx. Remember, patients during certain seasons may become sick. So while we're investigating this section, you want to look for anything bright red, possible white spots, anything that may tell us that the patient may be getting sick or may have something wrong with their throat that may cause us to want to postpone treatment for their overall benefit as well as our own. So you're going to have the patient gently open, stick her tongue out and say, ah. Apply a little bit of pressure on the tongue. Beautiful, I can see those tonsils. It looks as though she's a grade 1. Now remember, we do have new grading systems with our tonsils. A grade 0 means that the tonsils are not present, where 1, they're still hidden behind the pillars. So remember in our next segment when we cover this will be important for you guys to learn so you're able to properly document and also properly determine what a patient's tonsil grade level may be. Now, once we're done going through, I always find it important to just cover your tracks. So as we've gone through and done our intraoral exam, ask your patient to open, and you want to really inspect the frenums as well as the soft tissue. Remember, as a dental hygienist, the soft tissue is going to be one of the most important factors for you as we perform any type of dental hygiene care. So you want to make sure that you are fully able to see and describe both the attached as well as the free and the mucogingival junction, as well as the papilla, making sure that it's filling the embrasure space. Remember, at this time as well, you're also going to be looking for any possible lesions. You're going to be looking for any signs of clinical attachment loss. And don't forget the teeth. So many times we are all focused on the soft tissue, but we also want to make sure if we're noticing any additional signs that are also possibly on the teeth, which may include occlusion, which brings me to our next part. Remember, occlusion, the bite is so important to a patient. So you want to make sure when you have your patient bite down that you're extending the buccal mucosa, starting on one side, seeing either the molar relation or the canine relation if something's missing. And then same thing on this left side, retract, have the patient bite down, checking the molar region in this case, or the canine if something was missing. Then next, you want to, of course, check the bite. Notice if there's any overjet as well. And then, of course, do not forget about the patient's overall profile. This is something else that you need to also determine. So with that is going to conclude our intraoral exam. Please make sure that you are paying close attention. Remember, sometimes the hygienist is the one that finds things because sometimes the doctor may be so focused on just the teeth. So after you've learned your intraoral and extraoral exams, I know that you all will be prepared for the next segment of your national boards.